My meniscus is torn. Does that mean I should have surgery? When I first became a PT, 15, 20 years ago, if you had a meniscus tear, and meniscus are the little, kind of like the felt pads in your knee. They're obviously not made of felt, but they support your knee. They're kind of little C-shaped things that sit on the inside and outside of that knee joint. If you had a meniscus tear, everybody had surgery. That was really common. That was just, oh, you have knee pain, you have a meniscus tear, we're gonna surgically fix it. And that's changed. We don't do that anymore. And the majority of people who have meniscus injuries don't need surgery. They get better with strengthening, they get better with time. That has become more of the first line. Now there are more significant tears, and there is that group of people who don't get better, and those are the ones that need to talk to their doctor about a surgical option. Clients with hypermobility seem to have a lot of these kind of issues, the meniscus issues, labral tears in the hip, and particularly with hypermobility, surgery is never a good first option for you. So it is so important that you work on your strengthening and also work on staying out of that pain range. So often it's like, oh, it hurts there, so then that must be where I need to stretch. Particularly with meniscus and labral things, that is not the case. The more you go into that pain area, the worse it gets. And so you want to go to the point right before you hit that pain, and then you stop there. And as that heals up and your body gives you more, you want to take more of that position. For meniscus things as well, the biggest issue is actually not the forward and back, it's weight-bearing standing and then trying to pivot and twist. That's what really flares that up. So you do want to kind of watch that you're avoiding that. And if you're hypermobile, really you want to be careful with that in general, where you want to move your feet more. So instead of planting and then trying to twist, you want to actually take steps to kind of change your position. It's a good habit to get into in the beginning. Those are also things where different types of injections can be helpful. So if you are having a meniscus issue, definitely look at all your options. They take longer to heal. So many of the things that we treat, 6 weeks is a good period of time. For meniscus issues, usually we think in terms of 3 to 6 months. They don't have good supply. They are a slow healing area. So you do want to make sure that you adjust your expectations where it's going to take some time, which is frustrating. Doesn't make that easier that they don't tend to get better in a couple of weeks. And so even with good care, you still have to give it the amount of time it needs to recover. Now that being said, if it is locking and it's getting stuck where you can't straighten it, or it's getting stuck straight and you can't bend it, those would be times where I would say you definitely want to see an orthopedist. Just having a meniscus tear by itself really just means you need to take care of your knee. Ice it, make sure that you're keeping the swelling out of it so you don't get any secondary issues with that kneecap tracking. And then watch your mechanics, make sure you're not standing on and twisting. If you're still struggling with it getting better, definitely look at pursuing those other options. And if it's still not getting better, then you've always got that orthopedist for you.